Today we are going to talk about smokeless tobacco. In this presentation, we will discuss what is smokeless tobacco, then we will explore the various existing smokeless tobacco products. We will also cover some smokeless tobacco history, and lastly, we will talk about the health risks associated with using smokeless tobacco. So what is smokeless tobacco? Smokeless tobacco is not smoked. Users chew or suck on dip, tobacco leaves, releasing nicotine, which is absorbed in the mouth's lining. It can be spit or swallowed depending on the product. Smokeless tobacco is also known as chewing tobacco, oral tobacco, spit or spitting tobacco, dip, chew, and snuff. There are many types of smokeless tobacco used around the world. Here are just a few examples. Oral moist snuff is smokeless tobacco that is not smoked or burned. It can be chewed or sucked on and can be spit or swallowed depending on the product itself. One of the most popular smokeless tobacco products used in the United States is oral moist snuff, also known as dip. Snuff is a finely ground tobacco product typically placed between the cheek and gums or upper lip. It needs to be manually crushed for the nicotine to be released. Chewing tobacco is another smokeless tobacco product that users can chew or suck on, is known as chewing tobacco or simply chew. A portion of the tobacco is placed between the cheek and gum or the upper lip teeth. It is sold in the form of bricks, twists, or loose leaf. Loose leaf tobacco is usually sweetened and sometimes includes flavoring through other additives. The common chewing tobacco products sold include Redman, Oliver Twist, and Levi Garrett. Snus is a smokeless tobacco product that comes in the form of a tea bag, which is parked in the cheek. It was first seen in Sweden. Unlike U.S. snus, Swedish and European snus is pasteurized, meaning a process that kills germs. It also contains low levels of nitrosamine, which is a chemical compound that is generally carcinogenic. Dissolvables, tobacco products that slowly dissolve over time. It is finely ground tobacco held within a solid chemical shell that melts in saliva. They resemble small mints, toothpicks, dissolvable breath strips, etc. American inhabitants chewed tobacco in religious and political ceremonies as early as 1 BCE. Tobacco was used as currency in the 17th and 18th centuries in U.S. colonies, and by the 18th century, smokeless tobacco was extremely popular and was considered an American habit. Spittoons were even in Congress for legislators to use. During the 19th century, spitting tobacco became socially unacceptable and illegal in public places due to the risk of spreading germs and diseases. In the 20th century, smokeless tobacco made a comeback with the increasing number of young men using. Up until then, it was more typical old men to use. By the late 1990s and early 2000s, Clean Air Acts outlawed smoking in public places. Some of the factors contributing to the growth of smokeless tobacco market included availability of flavors, attractive pricing, and availability to use anywhere. Representatives understood the appeal of flavors to adolescents, as well as marketing sociability, masculinity, and individuality towards young men. However, in 2016, Major League Baseball banned smokeless tobacco for entering players and fans. As time passes, tobacco companies have created new products to cater to every type of consumer. Considering who is going to replace the older smokers, the big tobacco has made sure to maintain customers to make money off their products. Firstly, the people who use smokeless is changing. Older men are now using chew, while the younger men are using dip. Secondly, the way smokeless tobacco is marketed is no longer the same. Due to the growing variety of products and consumers, major U.S. brands owned by cigarette companies are also producing other tobacco products. Many of these products cater to the demands and restrictions placed by the law, as well as the changing mindsets of the public. Smokeless tobacco is a way around smoke-free environment restrictions, and they are being advertised as such. Many consumers see these tobacco products as having different health effects because they come in different forms, so they are being marketed as safer alternative to smoking. And lastly, the products themselves are no longer the same. There are more options now there were a decade ago, and new products are entering the market may also appeal to young people due to the various flavors being introduced like cherry, vanilla, apple, and many more. Flavors, nicotine, brands, and pricing, and there is something to be marketed for everyone's specific preference. In 2014, U.S. tobacco companies spent $600 million promoting smokeless tobacco. Based on the history that you just learned, why do you think Camel uses the phrase, boldly go everywhere and experience cleaner tobacco environment to promote snus? Do you think smokeless tobacco only impacts your mouth or oral region? Smokeless tobacco causes many adverse health effects in the mouth due to users having to chew and suck on the tobacco. Some of the oral conditions include oral cancers, including the area immediately behind the mouth known as the pharynx, mucosal lesions, which are membranes that line various cavities that suffer from injuries through wounds, ulcers, and tumors, gingival keratosis, tissue destruction associated with teeth, periodontal disease, serious damage to the gums which could destroy your jawbone, tooth discoloration, enamel erosion, the tooth's enamel destroyed by acids, gingival recession, exposure to the tooth's root due to diminishing and receding gum line, dental caries such as tooth decays and cavities caused by bacteria. Although the more serious health effects of smokeless tobacco may be delayed for many years, the early onset of smokeless tobacco use among young people provides time to build nicotine addiction and time for long-term exposure to the high concentration of carcinogens in smokeless tobacco. Smokeless tobacco may cause many other adverse health effects other than the mouth, including abdominal-related issues, such as pancreatic cancer, which occurs in the pancreas and is a gland that helps with digestion and maintaining proper blood sugar levels, and stomach cancer, abnormally high blood pressure, also known as hypertension, and diseases related to the heart and blood vessels. According to the Surgeon General data of 2003, frequent users were 3 times more likely to acquire cancer of the buccal area of the oral cavity less than frequent users and 4 times more likely to have throat cancer. Those who started using smokeless tobacco before the age of 14 were 20 times more likely to develop throat cancer. Many young people have misconceptions about smokeless tobacco. Some young people may not understand the oral health risks that may not fully understand the only high awareness of oral health risks outweigh potential dangers. An independent choice, especially risk relatively to cigarettes. Additionally, many users view health risks as distant and avoidable, if not less harmful than the other use of drugs. Others view it as part of the community tradition and culture way of life. Lastly, family influence can alter the choice to use. From the family having strong anti-tobacco expectations to reinforced acceptance, or superficially disapproving yet permissive and reluctantly accepting. All of these experiences come from a youth whom are current smokeless tobacco users. The U.S. government requires tobacco companies to have one of the 4 warning labels listed below on each smokeless tobacco package or advertisement. This product can cause mouth cancer. This product can cause gum disease and tooth loss. This product is not a safe alternative to cigarettes. Smokeless tobacco is addictive. Do you think that these 4 warning labels are a good representation of the health effects caused by smokeless tobacco?